I want to just start off by, first off, maybe I'll even let you do this, give people a little bit. Dr. Turkal is a family practice physician. He's still, as CEO, still sees patients in practice. And I was saying, and I know a lot of hospital system CEOs, that is one of the most unique things. And you're still practicing, right?
I am, and I think it's an important part of keeping me grounded, reminding me why we're here, why we do the work we do every day.
Yeah. So again, Nick is, I should say, was CEO of Aurora Healthcare. And in the news, for those of you who are following, there's been some big mega mergers within the health industry. And everybody's heard of like the CVS and Aetna merger. Nick has just recently completed a merger with Advocate Health, and Advocate Health and Aurora merged and are now the 10th largest health system in the United States?
That's right. So we were two systems, each about $5.5 to $6 billion in revenue, located in Chicago and Milwaukee, Wisconsin, and decided that if we could do something by coming together that was going to make patient care better, make us more efficient, give us more opportunities to get out ahead of the curve in healthcare, then we should do it. But we had to prove to ourselves that it was going to make healthcare better, or we were going to walk away from it. So we spent a number of months evaluating the opportunity and closed our deal in April and have spent the last 9 months heavily integrating the two organizations. It's been a lot of fun.
So now you get to spend your time in both Wisconsin and in Illinois.
Lots of windshield time. You know, I used to think it was very funny to make jokes about the governors in Illinois and how they all ended up in federal prison. And now I'm back in Illinois where I grew up. So it's I don't make those jokes anymore.
Yeah. Well, I was going to say, being a Philly guy, I mean, I love Chicago now after yesterday.
We don't love Philly so much.
Yeah. So when you said that the only way and the only reason that you would have done this merger is if it improved patient care.
Right.
What have you seen? And I know it's only been a short time, but what was your hope as you did the merger, and what are you seeing since you've done the merger in the benefits to the patients?
So, I'm a firm believer that healthcare has not been very rapid at adapting to consumerism, to giving patients what they need around access and ease of care. And so we wanted to measure this against what will it do to our efforts on consumerism, how it's going to help us on innovation, and how will it help us on some of our service lines. So as a combined organization, I believe we have the 5th or 6th largest cardiac program in the country. Our ability now to recruit very subspecialized cardiologists that can serve our 3 million patients across Illinois and Wisconsin it's just a different game than it was a year ago. So recruitment of specialists, augmenting skills that existed in one organization but not the other. That was especially true in the cancer area. We're now building up our cancer program. Neuroscience would be another example. So in some of those service lines, we are able now to provide a higher level of care even after a few months. And I think that will continue to evolve. The other areas, though, that become incredibly important are what people here today would want to hear about, and that's our ability to innovate. One of the things that has happened with being a larger organization, being a top 10 organization, we have had a lot of folks approach us from outside. So large organizations who might not have noticed us before now want to talk about partnership. But small organizations, like many of the companies here, we're a great testing ground for those companies. So with 3 million patients, nice cross-section of Middle America, we can implement something in one site and then spread it fairly quickly to other sites. Baby Scripts being an example of a company that we've worked with now for a period of time on the Aurora side, and now we can spread across the entire organization. So that whole area of innovation, the ability to change how healthcare is delivered, I'm ever more convinced that we have to do it piece by piece. There's no easy answer to making it better for patients. We got to look for companies that are going to help us.
Yeah, and also, are you seeing a change in as clinical trials and access to care for your patients as well?
We are. When we think about clinical trials and the ability to enroll patients, having a population of 3 million patients now is really incredible. You know, we can enroll a lot more people. We're attractive to folks who want to do clinical trials for the same reasons. We can spread it across 2 states very effectively. So we're actually doing more clinical trials than the medical school that's located in our community in Wisconsin.
Oh, that's amazing. So, being that we're here at a healthcare conference, and there's obviously a lot of entrepreneurs building companies, and the relationships in companies keeps coming up. One of the interesting things about the merger is you became a co-CEO, from CEO of Aurora to co-CEO of the Advocate Aurora Health System. How is that going? How do you find that integration of 2 very unique health systems into one has gone?
So when we were having these discussions, we had 2 organizations that were leading in their markets. And the board of directors of each of those companies said, you know, we're a market leader. We don't have to do this deal. There has to be a lot of good reason for it. Both boards really liked their CEOs. And to get this deal done, which we think is absolutely the right thing for our patients and the communities we take care of, this was the mechanism to get it done. So we have, rather than kind of keeping our previous responsibilities with me in Wisconsin, Jim Skexberg in Chicago, we've really scrambled the egg. So I have system-wide responsibility for the medical group and for government affairs and a number of things that I'm particularly interested in. And then Jim has other responsibilities that are system-wide. And we're together on a weekly basis with our executive team to make those critical decisions. So it's a joint decision-making process. Sometimes that makes it harder, but I think it also gives us 2 different points of view, so we come out with a richer discussion and good decisions, hopefully.
That's amazing. So do you think this is a look into the future for other healthcare systems? Do you think that these mega mergers are going to start to become more frequent?
When we look at the synergies, so just to tell you how we approach this, before the merger, we identified a single board of directors, which was 6 and 6 from the legacy organizations. We identified a single chief integration officer, and we set about creating 24 integration teams, all with goals, some financial, some around merging the elements of the organization. And we were absolutely determined that we were going to be disciplined about integration and get those synergies. So we have done that. I think companies that are willing to do that, these kind of mergers are really good. But not-for-profit healthcare has kind of a bad record of putting stuff together and saying, we'll get to that, we'll get to it, and it never happens. So my belief is you just have to be disciplined about this like anything else. And you have to be willing to take the best of 2 organizations and say, it's not all going to be the way that it was before. Yep. It's going to be different, and we can make it better.
Right, whether it's best practices or anything else, you have to take
Right.
the best of both.
So kind of a long answer, but I do think that we're going to see more consolidation. We happen to be in a kind of a unique position where we were neighbors, same size, merger of equals, stronger operating margin in Wisconsin, stronger balance sheet in Illinois. It was an easy decision. They're not all that easy.
Wait, you were neighbors. Were you competitive before the merger, or far enough apart that you were sort of like friendly neighbors?
Right, we were friendly neighbors. We also ran a clinical lab together for 17 years before the merger, so we
there was
knew each
history
other.
of relationship.
Yeah.
Oh,
That made it easier. Yeah. And it's like you started out this afternoon talking about family.
Yeah.
And being part of a blended family for the last 15 years, I can tell you what I've learned about blended families and mergers is it's all the same thing. It's one big family, and you got to learn to accept the best of both and come out with a really happy family.
Yeah, amazing. So, as a physician, so as you sit, we started the talk off the fact that you are still practicing, you still see patients, and you think it's a very important part of sort of keeping your finger on the pulse of what's going on in medicine. What do you think as patients start to enter into these larger healthcare systems? What other benefits? Because you sort of said, well, there's going to be some improvements in access, but what are you seeing, or what have you seen since April as some real just hardcore benefits to these patients?
Sure.
Reducing costs coming into that too, access to care?
You bet. So I'm just a huge believer in access, but access defined by the patient. So we have worked really hard we have about 500 sites across the 2 states now, hospitals, offices, urgent care. We have a partnership with Walgreens for the clinics that exist inside those stores. I think providing that whole range of access to patients is important, along with what we're developing in telehealth. So it's about not only how you make it easy to get to any of those, but how do you connect the dots for the patients?
Sure.
So we had a single electronic health record in Wisconsin, Epic. We started in December by implementing that record in Illinois for all of our physicians. So we now have physicians across both states on one record.
Right.
For the patients, that's really great.
It's huge.
Anywhere they go, the doctor pulls up the record and it's right there. It prevents us from doing repeating tests. It prevents us from making the patient wait longer. It just makes it easier from a patient's perspective. And, as a patient myself, I never call my doctor's office. I message my doctor, I refill my prescriptions online, I do all the things that our patients tell us they want. The more we can do that, the quicker we can do it, the better. So we're looking for companies to partner with that can help us take these processes in healthcare, break them down, make them better, make them easier for the patients that we take care of.
I think that one of the things you said about implementing digital health, telemedicine, there's very easy, in some ways, solutions to very common problems that we all face as providers, but as patients, whether it's just, again, like you said, accessing the physician, refilling prescriptions, asking a question, getting data and or medical records from one physician to the other. And I think that with the help of entrepreneurs, rethinking the way we care for each other, it's a huge thing. Oh, yeah. And for those of you who don't know, Nick really is at the forefront and has been at the forefront as a CEO of a very large hospital system. And these changes, it's not easy to get into hospital systems. The changes start at the top, and we always say it really is the mindset and the vision of the CEO that sort of carries through. And you have clearly, over the years, demonstrated, whether it's Baby Scripts or some of the other companies that you've worked with, a dedication to improving patient care through digital technology and through innovation. Do you feel that external innovation, so because you open your doors for people to come and work with you, do you think that encourages internal innovation as well?
Absolutely. So I think the exposure to external ideas we have 70,000 employees now as a combined organization. We want every one of those employees to be innovating about their work every day, how they could do it better, more efficiently. When they're exposed to people from the outside who say, why are you doing this? Why do you do it that way? It gets them thinking in a different way. Healthcare in general has not been good at that. We've been very programmed we get trained, we go, we do this, we do it the same way for years. We're trying to disrupt that. So it's partly exposure from the outside, partly creating the environment internally that says, we're going to set up a time, we're going to look at a problem in your market, and we're going to ask you as frontline employees to figure out how to solve that problem. So we have to nudge people along, and as soon as we ask, they have great ideas.
Yeah, it's amazing, right? There's
Exactly.
a lot of people, and some of it is that the health systems don't even ask, right? And you have to sort of bring it and sort of shake the cage and say, give me your ideas.
Right.
So I wanted to ask, just sort of end this on a personal note, because again, you were a full-time practicing family physician for a long time. What was the nidus that that helped you sort of decide to move from just practicing to really being a health change maker, right? An administrator that really wants to change the way we care for each other.
So I never imagined going to medical school to do what I'm doing now. It was not in my game plan at all. What I think changed my mind was my first couple of years in practice in a small community in central Illinois, where I saw how dysfunctional the system was for the community, for the patients, how difficult we make it. So I went through medical school and residency thinking, I'm going to go out and do great things, and you get out and find out it's not so easy.
Yeah.
So I got very interested in systems of care and how do you make a system work better. And my belief has been, and I feel even more strongly now, if we take care of 3 million patients, and I can positively affect the way we have outcomes for diabetes and heart disease and preventive medicine, then that's a good use of a physician's time.
That's a very good use of physician's time. It's interesting because we just had the talk with the Park brothers, but when Stephen and I and Unity and Barry, we were all starting Startup Health. We had a company before called Organized Wisdom, but I was in the middle of my practice, and Stephen says, well, we're going to work together. And I'm like, well, I take care of patients already. And he says, yeah. He says, but you take care of patients one at a time. He says, I'm going to give you the opportunity to take care of millions of patients. And think of that change. So I understand exactly where you're coming from.
Very exciting. The one message I would have for entrepreneurs here is please keep at what you're doing. I mean, healthcare is still badly broken. And if we can be impatient enough to nudge us along and get things changed, it's going to make lives better. It's going to save lives. It's going to make care better. It's going to revolutionize healthcare. We're right on the cusp. It is changing dramatically now. It's so different than when I started in practice, in a good way.
Yeah.
But our patients are going to push us quickly. I would rather stay out ahead of that and say, how can we make it better? So thank you for what you do every day, because it is making a big and positive difference for our patients.
Yeah, as Jill says, the urgency of now, right?
Exactly.
Yeah.
Exactly.
Well, thank you, Nick.
Thank you.
I appreciate you being here.
Great to see you.